Hi, I am Dr. Sandeep Kadam, consultant international cardiologist working at Dr. Kadam Heart Clinic and Diagnostic Center, Pune. I am working as a cardiologist for more than 10 years. So today, friends will discuss about the golden hours in heart attack. So what is the golden hours? It's the first hour after a heart attack, which is called as the golden hour. Why it is golden hour? Because heart muscles or heart is the organ where muscles get damaged after heart attack, which will never recover to the normal if they are not attended well. So once the damage happens, it will remain for lifelong. So first hours are important where we can reverse the damage to the heart. So at the end, heart function is the most important thing, and heart muscles are the important. Their normal functions leads to the normal life. If a patient who had a heart attack and who developed enlarged heart or poor function of the heart, then the life will be the future life will be problematic. He or she may get repeated episodes of shortness of breath and heart failure. So how to reverse this damage? So many a times when there is a heart attack, the classical symptoms of heart attacks are retrosternal, that is midline chest pain, or both the shoulder pain, arm pain, epigastric pain, or backache. These are the symptoms or jaw pain. Depending upon the patient's condition, different presentation can occur. It's not always the heart attack pain is always in the midline or in the retrosternal or on left hand side. It can be appear as a right-handed pain, right hand pain, or right shoulder pain, or a simple jaw pain. So many times the jaw pain is mistaken as a toothache or tooth problem, and somehow patient went to dentist and they found nothing wrong with the structure. In first hours, the medical attention is very important, and in that, go for the nearest possible hospital or clinic, get an ECG done, get the ECG readings, then some blood tests, what we call as cardiac enzymes. But the problems with the cardiac enzymes are they comes positive after 6 hours. So in early stage of the heart attack, these enzymes like troponin I or troponin T and CPK-MB may be negative or normal in early stage because they will rise in the blood after 6 hours. So how to damage the reverse or how to reverse the damage of heart muscle? So for that purpose, a patient needs some blood thinners and some injections. So blood thinners in the form of what we call as the antiplatelets and anticoagulants. The antiplatelets are aspirin, that is in the various form of ecosprin or simple disprin can be taken. Then other antiplatelet groups like clopidogrel, prasugrel, or ticagrelor. Any of these can be taken with the aspirin. Another medicines are heparin, which is an anticoagulant, which is needed. A heart attack patient in the early stage can be managed with some lytic agents like thrombolytic agents, which will dissolve the thrombus. These are various like streptokinase injections, urokinase, and altiplase, tenecteplase. These are the different kinds of injections which can be used to dissolve the clot. The another method is the primary PCI or primary percutaneous coronary intervention, in which patient is taken to the cath lab and angiography has been done, and with that angiography reports If the artery is 100% clogged, the clot and the block is removed by putting a stent, which is mostly the medicated stent, what we call as a drug-eluting stent, and achieve the flow of that vessels so that the muscle will not get deprived of blood supply and oxygen, and hence the pumping action of the heart or muscle will not get damaged. So the ultimate aim of this golden hour is to save the myocardium or save the muscle. In heart attack, the early complications like arrhythmia, that is abnormal rhythm, ventricular tachycardia, or ventricular arrhythmia, is one of the most common reason for sudden cardiac death. These can be managed in a ICU setup or in an emergency department where we need a continuous monitoring of ECG. So as soon as the patient of chest pain comes in the casualty or in the clinic, there should be a heart rate monitoring system which will clearly show us the rhythm of the patient and the ECG. So abnormal rhythm can be easily detected from such monitors, and emergency shock, that is DC cardioversion, can be given. So with that shock, the patient can get reverted. So why this fatal arrhythmia or life-threatening arrhythmia, what we call as a ventricular tachycardia or ventricular fibrillation occur? It is because of damaged myocardium or damaged muscles. The electrical activity, interference in the normal electrical activity of the heart lead to such abnormalities. Mostly the damaged part act as an obstruction, and the signals moves around that damaged part, and it create the abnormal rhythm. So to treat this abnormal rhythm, cardiac DC shock is important. Other medicines are there in which beta blockers, amide and other medicines are also there. So first golden hour is, so the important in golden hour, the most important part is to prevent the damage to the heart muscles, reverse the damage to the heart muscle, uh, control the arrhythmia which are life-threatening by various mode of treatments. All this together will reduce the mortality or death rate in heart attack patients. So first hour is very important. How to prepare for such kind of situations? So always remember, heart pain is never ever experienced in a life. It is the first time in a life. It is a kind of pain which is moderate or severe in nature. It is a squeezing type or some pressure on or heaviness of the chest associated with sweating, uneasiness, and sometimes palpitations and other shortness of breath. So these are various kind of symptoms that should be immediately taken into the consideration, and early or immediate medical help is important. So how to prepare for this? The ambulance number or nearest hospital number should be handy. If possible, a patient who are high risk for such kind of heart attack, such kind of scenes or scenario, please keep aspirin handy and try to call emergency number or ambulance so that they will get medical home also. If there is a if there is a delay in the ambulance, try and take to the patients to the nearest hospitals. So immediate medical help is very important. One medicine, what we call as a sorbitrate, is uh, one of the important medicines that should be taken. 5 milligram of sorbitrate sublingually, means it should be kept below tongue. It should not be swallow. It should be below tongue. Why? Because it acts fast with the, if we keep below tongue. If we swallow, it will take time. So for rapid action, it should be sublingual or it should keep below tongue. Simultaneously, the patient should lie down because many a times that sorbitrate may lead to reduction in the blood pressure or hypotension, and then patient may get collapse. Second thing, uh, do not overestimate or underestimate the chest pain. Always take the help of doctor to differentiate whether it is a heart related to the heart pain or any other conditions. Many a times people mistaken it as a gastric pain, acidity pain, and they land up into the massive damage to the heart, or maybe they succumb because of unattended medical attention. So today we'll come to know, or we'll keep in mind that first hour is a golden hour for the heart attack. Please be ready, be prepared for such emergency, and get a medical help on urgent basis. Thank you.